So this lecture is on the muscles of the back and the muscles of the chest. These are the muscles that go from the axial skeleton to either the back itself or the upper limb. So we have something we call deep muscles of the back, and we have superficial muscles of the back. And this is that comparison, kind of like I did for epithelium versus connective tissue. We talk about the differences between deep and superficial muscles of the back. One of the key things about deep muscles is that they are what we call intrinsic. Intrinsic, which means that they grow in place. They grow on the bones themselves. They are deeper to the core of the body. Versus superficial muscles are what we call extrinsic, which means they grow into place, they migrate. So extrinsic muscles actually start in the shoulder and their fibers grow towards the vertebra and the skull to attach. They don't start in place, they have to grow into place, which is why they are extrinsic or migratory. Deep muscles are what we call axial to axial. They attach vertebra to vertebra, they attach vertebra to the ribs, they attach vertebra to the skull, but they always attach axial to axial skeleton. Versus superficial muscles of the back are what we call axial to appendicular. We have vertebra to the scapula, we have vertebra to the humerus, we have the skull to the humerus, we have the skull to the scapula. So we have these axial to out to appendicular attachments. Key thing about deep muscles is that they only move the back and the skull. So they're very centralized, versus superficial muscles move the upper limb, right? So that's why we have this attachment to the appendicular. We're going to move the upper limb. And finally, from the other lecture on nerves and neuromodality and mapping, you may remember the phrase dorsal rami nerves. Dorsal rami nerves only go to deep muscles of the back, versus superficial muscles go to ventral, and I forgot the L, so I'll write it in. Ventral rami nerves go to superficial muscles of the back, as well as the other muscles of the limb, but superficial muscles, since they move the limb, get ventral rami nerves. Let's talk about the deep muscles of the back. The deep muscles of the back, there are three of them. There are erector spinae, which name actually means it holds the spine erect, transversospinalis, which is in the transverse spine, and splenius. Each of these is actually a group of muscles that function together. We're going to learn them by their group name. We're not going to worry about the individual pieces of these muscles. So we're going to learn the groups. So let's look at erector spinae. So the location is about, instead of doing origin and insertion for this group, we're just going to talk about location, is from the iliac crest, which is part of the pelvis, and the sacrum all the way up the spine to the other transverse processes and the ribs. So it's axial to axial. We think of the action as extending the vertebral column, so it's what keeps you standing upright. And if you activate only one side, it will bend you laterally. And my innervation is the dorsal rami nerves. Now this is a photograph of one of the models from the lab. And you can see where I've drawn the arrows. This muscle here is erector spinae, all the way up and down. It's on one side of this model. We will also see it on the cadaver. Splenius, the name means splint. Its whole job is to hold the cervical spine together. It holds things together. So it is from the cervical vertebra to the skull. The action is to stabilize the cervical spine, but also if you pull back and on both sides, you'll hyperextend the head, or they will rotate the head. And again, our innervation is the dorsal rami nerves. So here it is from the skull here down to the vertebra and there. So that is splenius. Transversospinalis is seen on a different model. This model's name is Big Jake. He's huge. His head is missing because it fell off and broke Dr. Burns' hand. I'm not kidding. So we don't put the head back on Big Jake. The key with Big Jake is he's the only place we can see transversospinalis. It basically goes from the spinous process to the transverse process of the next vertebra, And its action is it allows for the twisting of rotation in the back. Transverso, meaning transverse plane, so it's going to make us move in the transverse plane, which is rotation. And innervation is again dorsal rami nerves. So all three of the deep muscles are moving the back, and we have dorsal rami nerves.